Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and today I want to tell you about a really interesting case. I saw a patient this week who had spent a night in the emergency room a couple days previous to his appointment with me. He got in on a wait list, and I had an opening, and so he was able to get in. And I say, now that I know what happened, I'm really glad he was able to get in. So he was in the emergency room with symptoms that felt like a heart attack. He had left-sided chest pain and upper back pain in the sort of rhomboid area, as well as pain going down the arm and some numbness and tingling. So he went to the emergency room. He got all the tests, and they sent him away with a clean bill of health. They said, follow up with your cardiologist. And he came to me because his wife, who is a regular patient of mine, comes in just for maintenance every few months or so, had sent him to see me for a different problem with his shoulder in the summer. And that was resolved in one visit. And she said, I think you need to go see Rich. So he came in. He said, I am a total mess right now. And he works with exotic animals. So he has camels, he has llamas, he has macaques, he has all sorts of animals. And in the winter, they're all in a heated sort of warehouse barn environment. And he carries heavy bags of food for like camels and stuff. So that's how he injured his shoulder when I saw him over the summer. So I suspect that something similar happened with the left side, where maybe carrying heavy things took its toll. So here's what happened. He came in. He said, so I get this pain in my arm. He said, if I slouch and just breathe and relax, I can get the chest pain to stop, and the arm symptoms will release. But it's really hard to find a comfortable position. And I'm constantly in back pain. He has like this mid-back pain. He says it feels like nerve. I have like a nerve pinched in my neck or something, and it's going down my shoulder blade, and my bicep feels super tight, and I get tingling in my arm. And what else did he say? Well, anyway, so and the pectoralis pain. I said, okay, I'm glad you went to an emergency room and they have cleared you, because this is definitely stuff that would worry me. Let's treat it like muscular and see if that's what it is. So I wanted to press on different areas to kind of confirm nerve entrapments. So the back rhomboid area, the dorsoscapular nerve that runs down the medial border of the scapula through the rhomboids, innervates the rhomboids. I wanted to test that out and see if it was entrapped either in the upper mid-back area or the middle scalene. The most common entrapment of the dorsoscapular nerve, by the way, is typically the medial scalene and not the rhomboids. But So I was just palpating, and I pushed where the levator comes off of the scapula. That seems to be a common entrapment zone. And he said, "Ow, that's definitely a problem." And then I press on the middle scalene and the low end of it, and he said, "Ow, how did you know that that hurt?" And I said, "Well, if it's an entrapment zone, it's going to be a little more uncomfortable." So then for the arm, I'm thinking a bit of neurogenic thoracic outlet from the pec, like, because if he's having pectoralis pain that seems like a heart attack, that's how Janet Travell got interested in myofascial pain. I'm thinking pec minor, pec major, right? And pec minor, of course, can entrap the brachial plexus. So I pressed on the pec minor where it attaches to that coracoid process of the scapula, and that was very tender and sore. And then I was thinking the tension in the bicep and the tingling in the arm is perhaps the musculocutaneous nerve that could be entrapped by the coracobrachialis. So I press on his coracobrachialis, and he flinches. He says, "How do you know where everything hurts? How is it that you just press and you know?" I said, "Well, I'm testing my theory, and so far it looks like I know what's going on here." So I said, "I want to treat these two entrapments first and see where it lands." So the first thing I did is put him on his side, and I put one needle into the lower part of the back posterior border, lower part of the middle scalene, and I used a pointer Excel on like 1 hertz and just got it to go to just really release and become a lot less tight and hard. And then it was no longer painful to the touch. So I thought, okay, that's probably helpful for the dorsoscapular nerve. So that's good. Then I released his levator scapulae around the C5 area. And then I was pressing in the upper back, and it seemed like there was still some discomfort at the other end of the levator where it goes into the scapula. So I used some electric stim there. So then that was feeling a lot better, though if I pushed into the rhomboid major area, he still had some pain there. My assumption is that muscle was still stuck short. So I said, okay, we're going to leave that for a minute. No more nerve pain, right? No more nerve pain. He confirms, no, it's not like it was. It's not like that feeling of like a hot wire or something. It was just like muscle soreness. I said, okay, good. Now we're going to work on the front of the shoulders. So I put 2 needles into the coracobrachialis, and I hooked it up to electric stim for 2 to 3 minutes till it was really moving strongly. And then it was no longer painful when I pushed on it after I took the needles out. No longer painful, no longer causing tingling into the arm like it had when I pressed on it before. And the bicep was feeling better. So I said, okay, I think the musculocutaneous nerve is better. There was, I think, still a little bit of tingling if I had him go into like a ruse test, like the neurogenic thoracic outlet test with the arms at like 90 and 90, shoulder, holding the hands behind the plane of where your ears are so that you're pulling back a little bit. He still had a tiny bit of tingling, but not too much. So I said, okay, now we're working on the pectoralis muscles. So I released the pec minor, both the sternoclavicular heads of pec major, and then no more arm symptoms. So I said, okay, the last part is this painful rhomboid area. So I was using electric stim on it. I didn't see a lot of movement, and I'm not comfortable fishing around in the rib space. So I decided to put cups on it. So I put 2 cups on it, probably waited 5 to 7 minutes, got some really good reddish, purplish, pinkish sort of color. So I felt like, okay, this is definitely a sign this muscle was in trouble. And he felt excellent. So I tested in all the movements that were bothering him. He no longer had any chest pain. He no longer had any arm symptoms, no more tingling. And his wife happened to have an appointment this week for something that was bothering her. And she confirmed that he's doing great. So no more chest pain, no more arm symptoms, no more anything. So very nice. My suspicion is the middle scalene combined with the pec minor was creating a bit of a compression of the nerves in the arm, the thoracic outlet. The coracobrachialis was entrapping the musculocutaneous nerve, and the middle scalene was entrapping the dorsoscapular nerve, causing that shooting pain into his mid-back. And you can imagine how that would, especially if you don't know the nerves, you could think, I'm having a heart attack. And he's like 45, and he carries, it's winter. We're in Western New York where it gets really cold. And that's when people have heart attacks, when they exert themselves in the cold. We recently had a lot of snow, and two different adults who were in their 50s died from heart attacks from exertion moving snow with snowblowers. So no joke, when you have symptoms like that, it was wise for him to go to the emergency room. And he's the kind of person who will put things off, He came for his shoulder in June, and it had been bothering him for months. And his wife finally got him to come and see me. And he actually probably wouldn't have seen me, except that his wife is the niece of one of my regular patients, whom he trusts more than his wife on opinion. Okay, so when he said, you need to go see me, then he trusted because he knew that his uncle would not steer him wrong and send him to some hocus pocus sort of thing. So then he came, and then he was good, and he was glad he came. So interesting case, I thought, and I wanted to share that. I'm not sure if I have. Oh, okay. I saw another. I'll tell you one more really tough case, and I only saw her for one visit, so I'll probably have to give you a follow up on how she's doing. But in the U.S., our seniors don't get much care for pain. I don't know what they do in the rest of the world, but if you I have a patient. She's retired nurse. She's in her 60s. She's very active, social. She's very, I hear from her friend who brought her how active she is in her community, doing things and leading groups and all sorts of things. And she loves to be physically active. Here she is. I'm seeing her 2 months after, well, actually it's many months after she broke her shoulder and had a surgery. And then somewhere along the way in the recovery from the shoulder, suddenly her left hip and leg were just miserable. She couldn't even really put weight on her left leg. Pain down the front, side, and back of her leg. She had previous spinal lumbar fusion, and the doctors said, there's really nothing we can do for you. There's there's no intervention for you. And can you imagine when you're a physically active person and you're trained medical professional and you understand what's going on and you're being told there's really nothing that we can do for you. So her friend told her, you have to come and see Dr. Hazel. So she brought her, and I like it when I can treat somebody with just motor points and electric stim and then not worry about trigger points until the second visit. It's part diagnostic, and it's part not putting someone through more post-treatment discomfort than is necessary, because the first one is always going to kick up more inflammation than the consecutive ones after that, because we're getting into muscle that's never been treated, and it's more ischemic, and it's often chronic, especially on older people. So there's going to be more inflammation after even a gentle treatment with some electric stim, because you're getting that blood flow going. Well, that was not what I was able to. That my decision to do dry needling was because of how much pain she was in before treatment. And if you've listened to my podcast, you know that I always like to test things in the middle, right? So what did I treat? I was treating glutes, TFL, glute min, glute med, piriformis to start. And then I wanted her to stand and give me some feedback, because I felt like, well, if I hit piriformis, I'm releasing, any entrapment on the sciatic nerve. I pressed on the lower rotators and they did not seem hypersensitized. So I thought, okay, good. We're dealing with like a piriformis thing. Why is it going down the front of the leg? I think it was partially IT band syndrome and partially like rectus femoris tension. And I thought, what if there's other nerve entrapment maybe coming through the adductor canal? Then let's make sure that I treat the psoas and maybe adductor longus, gracilis, etc. So I did all of that, and then I had her stand, and for 15 seconds or so, she said, "Oh, it feels a little bit better." And then while we're talking, she says, "Oh, the pain is coming back. It's going all the way down my leg." And it looked like mostly like a little bit of quad, but mostly sort of the side and back. So I said, okay, sorry, we've got more work to do, because I thought, I'm not sending her away like this. Like, the decision is, do I think I'm helping her by not treating the trigger points, and because I'm afraid of post-treatment soreness when she has crippling pain if I don't treat? And just from my own experience, I usually choose to inflict more post-treatment pain and soreness to get them out of the debilitating pain and nerve entrapment that's going on. So I did dry needling on her gluteus medius in multiple locations, and trigger points in the piriformis at multiple locations. And piriformis is such a beast, because you start getting the tight bands that you think are going to be all you have to do. You feel like two of them or something, middle, upper part, near the sacrum, etc. And what happens is they release, and you're able to press, and you press hard because you want to confirm that it's no longer painful and just feels sore. And so I'll push, and then I realize, oh, there's ropey bands deeper than what I could reach before. So now there's these little guitar string taut bands in the middle belly of the piriformis that I have to get. So I get those, and I think, oh, I finally got it. I grab my massage gun, where we're going to run it all over everywhere to make sure nothing hurts and it's just nice and sore. The glute med ones where I was able to find and release. And then you're digging in, and you think it's better, and then you hit a spot and they say, because it hurts. And then you realize, oh no, there's like another one. You have to push really deep, and you find that tight trigger point, and then you get that to release. And then even when they seem pain-free with the massage gun and pressing, you have to assume that the next time you see them, there may be more, and there probably won't be as many, and it won't be as debilitating. The pain won't be as bad, but they'll still have symptoms, the sciatic sort of thing. So being that she's a nurse, I felt, I just spoke to her like in clear, scientific like understanding. I said, this was all ischemic. There's going to be an inflammatory phase here. I need you to do stuff to clear this inflammation, because in my experience, the people who do not have quicker recovery are the ones who chose to do nothing. So I need you to massage it. I need you to heat it. I need you to move. I need you to walk short distances in the house. Just use those muscles to pump that inflammation out. Otherwise, it's going to be uncomfortable for a longer time. Trigger points can take 7 to 10 days, sometimes 14 days to heal. And the more diligent the patient is at clearing that inflammation, the better. And when they don't do it, they may see you a week or two out and still have muscular soreness that they think they're not better. And what you'll find, the reason you know that they were better, is that just doing motor points for 10 minutes with some electric stim pumps out the rest of the pain chemicals, clears out that inflammation, and then you don't need to even dry needle and they feel better. So I just really wanted to impress upon her. And then I saw her friend a day later for her acupuncture visit. And I said, please remind her how important it is to do this and clear the inflammation so that she's not worrying that she's not going to be better for the next week or so. Because I feel confident that I can help and that this treatment will have helped her a lot. And she's going to doubt it until that inflammation clears and she can actually feel the improvement. No, she walked out way better. Okay. Like her friend was kind of shocked how quickly and easily she stood up from the massage table when she had been almost falling down and holding a cane on her way in. And this is how she'd been in for a couple months, having to like hold the wall occasionally to not fall because of how painful and weak her leg felt. So her friend was surprised at how well she stood up, and she said, I definitely feel better. And she thanked me many times. So I know walking out, she was good, but here's what happens. The inflammation hits that night. Next day, that whole healing process kicks in, and they start to doubt that they're better, especially if they have any sort of sciatic symptoms because of inflammation in the piriformis or that area. So it's so important to remind them to get that inflammation moving, get it out of the area so that you can feel better faster. And if you do nothing and you just sit and watch TV for 2, 3, 4 days, it doesn't feel better, and you start to feel more hopeless because you've been suffering for so long. So what I told a friend. I said, I'm not concerned she's not going to get better. I'm concerned for her mental state because of how much pain she's been in. And then she got a brief moment of feeling hopeful. And then she's going to think it didn't get better because the next day, a lot of her symptoms are back. And I need you to explain to her to clear that inflammation. I know that in when I see her next, she will be feeling better. And I'm hopeful that it won't have been for just like 2 days that she felt better, that she'll move the inflammation. And if she feels like getting a massage, go get a massage, because that's like the best thing you could do. You can just relax and let somebody else push all that inflammation and toxins out of there. So interesting cases. I get so many nerve related cases now. I don't know how it happened, but I wonder how many I used to see and not recognize for what they were, and maybe not getting the best results because of it. But anyway, so I wanted to share those cases, and yeah. So I'll be covering some of those nerve entrapments in Sydney, Australia in March. Um, many of them are covered in the recorded Sydney, what do I want to say, courses. And let's see what else. The the sciatica stuff is definitely covered in Sydney courses, and I created a course that's a combination of those advanced days from the two Sydney courses. That's just sciatica and pseudo sciatica and migraines. So, and those covered the dry needling as well of the piriformis and the glute medius and things like that. So, if you are not getting great results in your first or second session with somebody with those problems, then you might want to check those out, because there is a clear pathway to getting people quickly out of sciatica and daily migraines. Okay, so that is that. It is the 21st of December, so I will wish you all a Merry Christmas and Happy Hanukkah and Happy New Year. I hope you are all well and having a great holiday season. So I will talk to you soon.